Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Yeah. So we do have a parent who wrote in and said, what do goals look like for older kids? We stopped at 9 because I felt like I had a handle on it. And I think that a lot of people, my son stopped having ABA therapy intensively at 8, but I will tell you that obviously we still use the principles of ABA in our home on ourselves and on our child. And I have been incredibly lucky that even though we stopped intensive therapy, I continued to work with you and other people and pick your brains on a regular basis.
Yeah.
So I would be a liar if I said that we just went, woo, we done, and we had it all figured out. That's a lie.
So, there's, I think the focus changes a little bit after a certain age, just because there are skills that develop later in life, right? So whenever a child is pretty young, a lot of what we're working on is just mostly based on language. It's focused on teaching aspects of language, speech and language, and some play and a lot of social and so on. As the child starts to hit 8 and 9, you start to go into this whole world of very abstract concepts. And really what you start to focus on are what I consider to be the higher areas of the curriculum. So we're talking about a lot of cognition, a lot of executive functioning skills, and a lot of social skills. And so, social skills will vary. There'll be things like how to play with other children, how to interact in a group that you know versus a group you don't know, how to help someone whose feelings were hurt, how to understand. There's like all this, there's a lot that has to do with just social conversation and things that, our behavior changes a lot in different social settings. So that's the social area. But as we know, there's this area, there are two areas that tend to be a little bit weaker in a lot of our kids. And one of those is perspective taking, or what we call theory of mind. And this has to do with teaching the child how to see the world through the eyes of others. And it's a very, very difficult thing to teach that to, let's say, a 6-year-old, because even in typically developing kids, that's a skill that begins to develop around 5 and 6. So, it's not something that we usually teach our children unless they've mastered a lot of other language, because it's very difficult to teach it as an abstract concept. But once you start getting into it, there's miles you go with just that concept of perspective taking, because you're talking about teaching a child. I mean, perspective taking will affect everything. It affects how we feel, because another child might knock down your backpack and you will think that, oh, he did that on purpose, because you're not able to see things from his perspective. Whereas if you did, you'd realize your backpack was in the way and it was an accident. And so that's like one way it affects us. Another way that it affects us is, we cannot understand other people's emotions. And once we start to understand other people's emotions, it also regulates our own behavior, because we realize how they are perceiving us. Understanding other people better helps us understand what they're trying to explain through nonverbal language, how they're inferring certain things, how their facial expressions are expressing. So understanding theory of mind, or, what we call social cognition, or the other person's perspective, helps a lot of other skills, right? Telling jokes, telling lies, all of these types of things, which are skills that are actually very important for 9 and 10-year-olds, are dependent on this whole area of the curriculum called cognition. Being able to understand your own thinking, be able to understand other people's thinking. And another area of the curriculum which we rarely start teaching earlier than, let's say, age 8, is the executive functioning area. And that has a lot to do with planning. And, as you can see right now, Shannon, with GEM, and the older we get, a lot of what we do now does not have an immediate consequence. It has a long-term consequence, right? I mean, you were talking about going to the gym. That's a really good one. It's not an activity that most people enjoy in and of itself, but people go to the gym because the long-term consequences, they feel better, they're healthier, they look better, whatever it is. And teaching our kids to be able to postpone or delay their reinforcers is a very, very important thing. And also, if the reinforcer is out here somewhere, what are the steps I have to take to get there? What are these steps to my goal? And making those steps, and during taking, being able to inhibit distractions while you're on the steps towards your goal. And all of those types of things are called planning. And planning is a very advanced skill, and all of the things that go into teaching that take time, and they're not appropriate for younger kids. So a lot of our curriculum in the areas of executive functioning and all that came into place once some of our youngest children hit middle school, and middle school is so different from elementary school. And we were like, oh gosh, we now have to teach the child how to take notes so that he knows his homework is due in 4 days or in 3 days or next week or whatever it is. So a lot of things, it's just much more abstract. So the things that happen past age 8 and 9 are more in the abstract range if the child has really mastered all the earlier areas. And if they haven't mastered the earlier areas, then it doesn't matter what age they are, because we still have to go back and work on the basics, the stuff that we all need, which is language and being able to comprehend, listen, receive information, and communicate. So those are some of the things. The curriculum changes pretty significantly as we age, and maybe we'll do a show sometime, Shannon, where we just talk about the areas of the program.
Yeah, absolutely. Because it's funny. I love listening to you, Dr. Granpeesheh, because you just know so much. Because my head immediately went to having, just gone through those teen years with GEM. One of the things that we discovered was that there on Pinterest, there are just like all these lessons that are just life skill lessons that are just all the things that I don't know how we used to learn it before. I think we learned it because our grandmothers lived with us and we just like picked all these things up. But even, when COVID hit and Jem was 16 when COVID started, we just, there's a whole bunch of things that he wasn't getting that we knew that he was going to need. And there were life skill worksheets on Pinterest that were things like explaining, insurance to all levels of people, about why you have insurance, why you don't have it. That would never have occurred to me.
Yeah.
But there was one day when we sat down and talked to him about insurance and taxes. And it was and there was another day where we sat down and showed him how to address an envelope, because it never occurred to me.
So interesting.
That nobody's teaching that in school anymore. There are all these things that were going to be necessary for him to be an adult that hadn't occurred to me, in addition to all the things you're talking about.
No, I appreciate you bringing that up, because my mind didn't even go to adults. My mind just went to 9.
Yeah.
And 9 to, let's say, 12, right?
Yeah,
because
you're right.
After that, there's, as you know, we have a ridiculous curriculum for our adults, which is massive. And you talked about some life skills. There's so many things. I mean, from like, how do I, and it doesn't, and there's, of course, with adults, everything we have is like at multiple different levels. So it's an adult who's extremely high functioning, looking for a job, and what do they have to do to get a resume together and go and apply, and how do they practice for that, for the actual interview and all that. Or an adult who has just enrolled in college, and how do they deal with all that. Or an adult who has just learned how to get on a bus and how are they going to go from one place to another, or an adult who is, I mean, there's like, how do I prepare food? How do I take care of whatever it is? There's a million things. And it really always just goes back to, and you started the show with this, which is, what does that individual need?
Yep.
And if the individual is at a point where the more important things like safety and etc. are taken care of, then sure, we can focus on daily living. But if that isn't, then we have to focus on safety. And it's about each individual. And there's 1,000 things that are taught past 9.
Oh my gosh, so very many things. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.